Hello, my name is Mary, and I'm currently studying at Grand Canyon University. Today, I'd like to take a moment of your time to discuss with you ethical issues and research surrounding communication. When communicating scientific information, you must first realize the impact of what your subject material has on the audience you are speaking with, as well as the implications that it contains. It helps to know the principles of scientific communication. Three main principles are to know the material in order to be able to discuss it. Be literate, clear, and concise, and know your audience. They may be culturally different and need further details to understand, or they might need something rephrased in a slightly different format. They may be resistant to change and need further compelling facts and evidence. Or there may be a room full of educated individuals, such as nurses and doctors, who can have specific details skipped over. Be accurate. Accuracy counts toward believability. Do not make things up as you go along. The audience will see right through that and your credibility is lost. Use informative statements that your audience will understand. There are instances that can hinder understanding, such as language barriers, cultural differences, and healthcare literacy. Medical jargons are big. Cabbage is one such medical jargon that can be greatly misunderstood. To medical staff, it is known as coronary arterial bypass graft. It's a surgical procedure to restore normal blood flow to an obstructed artery. If a family member were to hear medical staff discussing their patient and the family member in the same context as cabbage, they may misunderstand and think that cabbage is a different way of saying their family member is in a vegetative state, when that is not the case at all. Know when to use medical jargon. When conducting human research, whether in the allied healthcare field or not, it is imperative to know what the ethical considerations and constraints are. Prior to starting any research project, it should be looked at by a third party, such as an IRB, an International Review Board, to be certain that it follows the ethical guidelines mapped out in the Code of Federal Regulations. It's Chapter 21 CFR Part 50 to be exact. The regulation governs human subject research and is continually monitored and adjusted to protect the rights of individuals. It is imperative to obtain patient consent. Each patient within the study must understand the possible ramifications of said experiment. The patient has a right to confidentiality at all times. The biggest takeaway is to do no harm, either physically or psychologically. It is unethical to intentionally put the patient in harm's way. If this unintentionally happens, the research must be stopped immediately. Prior to restarting, the project must be re-examined to find out exactly what caused the harm. The project may not be able to be resumed. The patient's rights, safety, and respect are the most important part of the human research. When communicating with patients and/or family members of patients, treat them all with respect. Avoid talking down to them and have an actual conversation. Ask them if they have any questions and answer them fully and appropriately to the best you can. If there's a question that is out of your scope of care, tell them you do not currently have the answer, but you will find out and get back with them. Make certain you follow through. If there are any cultural differences, respect them. And further, find out if there's anything else you can do to help the patient or family member if they're in distress or confusion or for any other reason. If there are barriers such as hard of hearing or deafness, make sure there's a means to communicate with them. Do not rely on family members to translate for you. They may inadvertently hold back because they do not understand, or they may want to respect and protect their family member. When communicating with medical staff or healthcare providers, use clear, concise wording. Use facts that are within your scope of care. Do not state rumors or anything that you may have overheard, but do not necessarily omit anything either. If you're on the phone with a provider, then you are effectively their eyes and ears to that patient's care. Do not disrespect the patient by omitting something you feel is not pertinent to their care. Just use sound judgment. Also, use the tools that were given to you. One great tool is the readback function. Have the patient or the family member state back to you what they think that they have heard, so you know they completely understand what is being explained to them. And when speaking with physicians, read back what you think you have heard. Again, if they are giving orders over their phone, 1 milligram of medication is vastly different than 0.1 milligrams of medication. Read back what you think you've heard to make sure you've got it right. This is also true when needing to communicate within a formal writing correspondence. Make sure that what you have written is clear and concise. Use facts, leave out opinions. It's also important to leave out abbreviations as well. For example, depending on how it is written, the initials PT could stand for patient, prothrombin time, which is a laboratory test, physical therapy, part-time. You get what I'm saying. Sometimes letters need to go out to physicians to alert them that the laboratory or imaging is bringing on a new test, which they need to know exactly what it is for, how to order the said test, and what the ramifications of the test include, and so on. It is important to communicate effectively in these conditions. Communication is necessary in the healthcare industry. It must be understood in order to use it effectively. Ask questions. Find out what you do not know, and if something is not understood, ask for it to be read back to you. Communicating science can be difficult, but when it is used appropriately, it can be used to update, educate, and make others aware of what is happening. I hope I've given you some insight regarding ethical issues in research and how to effectively communicate them to others. Thank you for listening, and have a great day.